I see Governor Pagdanganan, but can we take a question from UP Open University? The moderator there is Dr. Melinda Lumanta, and then we turn to questions from the floor. Dr. Lumanta, UPOU, please come in.
Yes, good afternoon from the UPOU headquarters, Los Baños. Joining us today are faculty staff of UPOU and guests from the Los Baños Doctors Hospital. We have a question from Dr. Renato Torres, a family medicine doctor and UPLB professor in human ecology.
Good afternoon.
Let me just read the question from the UP Open University. It's meant for Dr. Romualdez. Is universal health care socialized medicine? I think it's a fair question to ask. No? Would it result in government control and intrusion into healthcare options of individuals? And who will pay for universal health care? Excellent questions, I think.
Yes. Yes, universal health care is socialized medicine.
All right.
Now, I just wanted to get over that hump. Because when I was growing up in a household with two doctors, my mother and both my parents, socialized medicine was an evil thing. It is what communists did, in China and in Russia. But socialized medicine is also what the Brits do in the UK and what most of Europe does. It depends on how you define socialized medicine. There are people who will deny that what they are doing in Canada is socialized medicine. But it is a matter of definition. Sure, Canadian doctors are not employed by government, but their pay comes from government. They're not employed, but they're registered and so forth. Will that result in intrusion by government? Yes. That is why we have government. Government is supposed to intrude in things that are good for the public. Okay. Who will pay?
Yes.
We will pay. Those of us who pay taxes, I hope there are some of us, and those of us who will have to pay our premiums to feel health, those of us everyone who smokes a cigarette or drinks tanduay, they will pay because the money will come from their taxes. We are asking for tax-based. Of course, we're saying maybe we might need to increase some of the payments we make. But that is up to us to decide. The point is, it is us.
So you want to remove health as a public good from market determination?
We want to markedly reduce the impact of direct impact of market forces on the ability to access care. Because what happens now is, if you do not have money in your pocket, and some of us don't even have pockets, okay, then you have no health care at all.
You will never win as president of this country, Dr.
I will leave that to Chairman Bernardo.
Anyway, we have a question from, nauna po si dating gobernador ng Bulacan, si Obet Pagdanganan, and then kayo po from the nursing profession.
Thank you, Professor. Good afternoon, and thank you. Congratulations to the UP panel. In the Philippines, in field health, they're using the FFS system, the fee-for-service, which invariably has resulted in bloated claims, padded medical expenses, and definitely more expensive medicines. This has been shown in many parts of the world to be resulting in corruption and therefore ineffective coverage of health. In some other countries, they have adopted the contractual capitation system, which has resulted in emphasis on preventive medicine, lower cost of medicine and medical expenses. Is the panel looking into that system or add some other options that shall focus on the preventive, which is less expensive, rather than the curative system in the country, which is a lot more expensive? What has the panel to say about that?
Thank you very much.
Thank you.
I think all of us agreed that in fact you can't isolate the different levels of healthcare one from the other. I think we need to look at it in an integrated way, and to make sure that if a person first should have access to information that will promote his health. That means that he or she knows how to keep healthy, yun promotive, and that he or she, the people, have enough information to know how to prevent diseases from getting them. And if they get sick, then they should all have access to curative services, and if they need it, rehabilitative services. So we are advocating making available the whole spectrum of services. Okay, and automatically that will mean savings upstream. And with regard to looking at different systems, the capitation system, people service system, and so forth, we have many examples around the world. What I suggest is we take a look at all of them and develop one that is truly suited for our own needs. I think some capitation can be done, some fee-for-service can be retained, many different systems that have worked in other countries should work here.
Thank you. We have a question from a representative of the nursing profession. Sige po. Please
Yeah,
identify yourself.
good afternoon, from the Voice of a Nurse. I'm the president of the Association of Deans of Philippine Colleges of Nursing. I'm Carmelita de Vinagracia. I support the idea of Dr. Domingo and Dr. Romualdez in terms of recognizing the nurse who incidentally at this point in time are hard up because there are thousands of skilled, technically know-how nurses who are in the Philippines right now. And just to let you know that our nursing curriculum has become a very dynamic curriculum. And just to let you know that in terms of competencies being acquired by the nurse can always be there in the community level or even in our NCR level at this point in time. However, in terms of acknowledging the nurse competencies in terms of healthcare, it is again the physician, as it has been discussed, in terms of legalizing their ability to be able to come up to health assessment, not necessarily in terms of prescription. There is the nurse who can take care of a patient, of a community, at the community level when there are no physicians. My heart will always tell me, there is a nurse. If there is no doctor, there is a nurse there who can really give health care, probably caring, more caring, compassionate in terms of giving care. I'd like to say that at this particular, in our administration today with GMA, I'd like to say that there is a program right now of the nurse program, nurse assigned in the rural service. But because we don't have the money to support this particular project, I believe that it is going to die down. But this particular project, this year, has been expanded to nurse in the rural school as a program. And we were talking about health education, and I believe that if this particular project will go on, it will going to help a lot of Filipino people because of health education at the school level. Thank you.
Salamat po.
Yeah.